Good afternoon, everyone. Just letting you know we'll begin in a couple minutes once we have more participants on. Okay, so I think we'll begin, and for others that are able to join on a bit later, we'll work to catch them up to speed. So thank you to everyone for joining the lead proof of concept cohort data learning community session 4. We're really excited that this session is going to be focusing on establishing a research partner, really thinking about how a research partner can support and advance your lead initiative in a number of ways. We'll have separate breakout sessions that divide the group as well, and then we'll have time to come back together. Just to begin with, I wanted to turn it over to Rebecca, who's going to give a bit of a preview of some exciting things that are to come moving forward.
Thanks, Sarah. Hi, everybody. We're getting started so on time. So I'm Rebecca Brown. I think you mostly know me, but I'm the consulting expert for the lead proof of concept project, which means that I'm working behind the scenes to do things like work on the evaluation management with Emily and Sarah, and do some communications development and so on. But we understand how important tech capacity is to things like data. And of course, they're not the same thing. And we're hearing from a lot of sites that it would be really super helpful if we could provide sort of really informed guidance that relate to tech and tech systems and infrastructure. So we're developing a new resource. This is kind of a preview of coming attractions. We're still hammering out the details, but we're developing this because we know that, I'm thinking of this as a tech acceleration project for the proof of concept sites. We know that all lead sites face really similar tech-related challenges, that you have multiple stakeholders in a site that have access to or contribute to or need information, but their tech systems don't talk to each other. And many organizations, both in the nonprofit sector and in the public sector, haven't really had the opportunity to invest in tech infrastructure for decades. And few sites have a partner who can really help develop that capacity. So the needs are common. Like, we know that everybody wants case management. Everybody wants to get tech systems to talk to each other. Everybody needs some.
If you want to share my computer, you can.
Oh, I'll just do that.
Okay.
Hold on, I think somebody needs to go on mute.
It's me. Sorry, it's Lauren. We just jumped on. I'm here with Brittany.
Can you put yourself on mute, Lauren? Thanks and welcome. So we know the needs are common across the sites, that everybody wants case management, everybody wants to get tech systems to talk to each other, everybody needs somebody dedicated to solving this problem. And then of course, case management is not the only kind of tech system you need. You know, there might be a CRM, a constituent relationship management database. So it's a very complicated field. And it often falls to the project manager or project manager organization to try to solve it. So that everybody has this problem, but the solutions have to be crafted to reflect your local initiative. So we're developing a partnership with an organization that designs and implements tech solutions. This is why we're thinking of it as a tech acceleration project. We're hoping through this project to provide 4 types of support to you as proof of concept sites. There we go. 4 types of support to the sites. We want to develop an overview of the kinds of tech-related needs and opportunities that are common to the sites. And we want to design some tech prototypes, kind of like a tech system map of the conceptual solutions, the tech solutions that could help guide you all in making your own tech decisions. We also want to design and host a virtual kind of tech accelerator group with online, virtual training through our project partner to support lead sites in building your own tech-related capacity, like the human capacity, while also fostering conversation among US sites around the kind of tech challenges and solutions that you've found. The third is that we want to identify site-specific tech-related needs that affect your ability to achieve collective impact. So for example, case management decisions. And the fourth one is we want to conduct site-specific tech assessments and develop customized recommendations for each site that we would, help inform your decisions and then perhaps be able to also help in the implementation. So assuming we can move forward with this work, which it looks likely we can, we would likely undertake it as a kind of an accelerated sprint, like a 16 weeks. We want to see something substantially different in each site, a real problem solved in each site in a pretty short period of time. We want to help you identify and address really high value added solutions as rapidly as possible. So this is a sneak preview. Stay tuned. It's under development. We'll have more news as we share more news as we have it, which I think should be in pretty short order. If you have questions in the meantime, you can reach out to me. It's rebecca.brown@leadbureau.org. But we'll keep you informed as we develop more specificity that we can share with you. So that's on the horizon.
Thanks so much, Rebecca. That's so exciting to hear. And I know everyone will be looking to have hopefully an update soon. It's awesome to be able to help build out the tech capacity for the sites. Okay, so for this session, I'm going to go back. So for how this aligns with our learning community goals. So we have been talking a bit about understanding the core metrics. We've talked a lot about the logic model, and we'll talk a bit more about that on this session too. And for the next 3 sessions, we're going to break down the discussion of some of the core metrics. The other goal of the learning community is to work to develop a data plan of how to track changes, services, policies, improvements, and larger scale systematic impacts. Then the third piece, which is really what we're getting at today, is to be able to identify a research partner to create an evaluation plan. And we know some of the sites on this call have research partners, and we're excited that some of the research partners are on to join this discussion as well. So for today, we're going to talk through how a research partner can be helpful for your initiative, really and trying to talk to different audiences. So for the project managers, really thinking about what lessons you have learned from data collection, research, and evaluation partnerships, and how you can use that knowledge and help share with other sites, but also to inform what you would want from a research partnership moving forward. And then for research partners, what lessons have you learned thinking through the work in LEAD? So we're really hoping to create a space for research partners to be able to discuss with each other some of the work that they've been doing across the LEAD proof of concept cohort sites too. So we're going to start with what is a research partner and why do you need one? So just an overview of some of the information of how research partners can be helpful. We're going to talk a bit about developing a research partnership and how can a research partner support an evaluation. Then the majority of this, as usual, will be discussion focused. So we're going to break out into 3 different discussion groups. The one will be just for the research partners. The second will be for sites with research partners. And the third will be for sites without research partners right now. And then we'll come back together as a group to share some of the key takeaways from those discussions and to be able to discuss some of the plans moving forward in the learning community. So when we're talking about research partners, it's really thinking about how to take research and bring it to practice. So as we know, some larger scale research can actually take a really long time to develop. So for example, if you're doing a randomized controlled trial or even to track long-term outcomes, it can take a number of years. So how can developing a research partner help support some of that cutting edge research and bringing it into practice. So the practice side being the lead initiative and really thinking about the experiences that you have and trying to pair that with research partnerships who might have some additional information that can be helpful in terms of implementation science, data collection, evaluation, and really thinking about how the research partners can help bridge the gap of translating research to practice through development of these partnerships. When you're thinking about these partnerships, we're really thinking about it in a couple of ways. So how are you actually thinking about the need for new action versus the importance of the findings? So really, oftentimes when we're going through program implementation, you are trying to address the immediate issue or barrier that may come up as you start to implement. So you're heavy on the action, but maybe at times you're trying to spot fill. So you might have less on the research piece. So what we're really trying to do in promoting these coordinations is thinking about action that's consistent with research. So if you're going to make an implementation change, are you actually measuring whether that change is effective for the participants, if it works within the flow for the staff or the team who's leading the program? So really making sure that any changes or actions you make are consistent with what we know about the research. So why do you want research partnerships? So I think research partners can be really important because they can provide a lot of different values. They can really support in assessing the problem. So thinking about the needs of the site and then how to actually design something that would be helpful with the needs. In some cases, identifying evidence-based strategies. So it could be in helping to enhance a service referral process that you might have, or helping to really hone in on a screening process that will help determine people's needs in a more consistent way across all of the program participants. Assisting in the larger strategic planning efforts. So they could potentially support some of your policy work group meetings or thinking through some of the larger efforts and how they connect within your community. Really thinking about implementation. So how can you bring implementation science into your program, and thinking about stakeholder collaboration and building on some of the plan, do, study, and act methods of implementation to actually test before you're able to move forward. To provide ongoing data collection support and feedback. So how is looking at your data helping you monitor your program and letting you know when there might be changes that could be made in order to make either processes or the outcomes improve. Also thinking about how to evaluate the impact. So through this work, a lot of what we're talking about is the movement towards evaluation. So thinking about what kind of evaluation could be helpful and why that would be the request of your site, and how you can use a research process in order to help solve those local problems, whether it's building some evidence to support your program and help you with long-term funding strategies, or helping with process improvements through your program implementation. So what is the role of the research partner? And this is really going to vary by site. And as always, we'd encourage you all to have your lead initiative teams think through this before reaching out to research partners, or as you're continuing to develop your relationship, to really think about the different types of research that might be useful to you. So you could consider action research or implementation and evaluation support, evidence-based practices, or some more basic research and support in data collection, management, data cleaning, things along those lines. So it's really first step is thinking about what's best for your initiative. What is the gap when it comes to data collection and evaluation, and building a case to support your program within your communities. Some questions to think about for the research partnership. So I think a key piece is having a researcher that understands the lead model and, is able to think about some of the lead core principles, such as harm reduction, being culturally responsive, considerations of race and equity and inclusion within the work, really thinking about what research methods that research may be focused on. So are you interested in a more qualitative or quantitative approach, or a bit of both? And the time frame that you'd like for the engagement. So you're trying to develop a look at your program that might be a year in time or several years in time, which maybe would be funded through grants, or are you actually looking to develop a long-term partnership that will support ongoing data collection? A key piece of this is really trying to think through roles and defining what the role would be for the researcher and the lead staff. So what is the project manager doing versus the case manager versus the research partner in terms of data collection and support towards evaluation? How often does the lead team actually want to receive feedback, and what feedback would be helpful for them in order to continually be able to make improvements to the program and be responsive to participants' needs? So is that a monthly meeting? Is it more than that? Is it less than that? Is it really just feedback at certain intervals that people are looking for? And overall, a big question which we're supporting through this learning community is, how does the partnership help move the field forward? So how can we help build more research capacity on the lead model and be able to think about how it can improve the systems within the local communities through tackling some of these challenging issues that all of the lead initiatives work towards? A couple of things to consider in a research partnership is really thinking about how often presence, how often you'd like to communicate with them, what that would look like, what kind of interaction you would like to see. The responsiveness, so like, are there certain intervals that you would like to communicate with them? Are you expecting daily emails and communication? Is it less intensive in terms of what you're expecting? For the types of communication, what does that feedback loop look like to the project manager versus other team members, or to community engagement side presentations as well? Thinking about how the information is relayed. So is it a 2-page document that summarizes some of the key outcomes on a monthly basis? Is it presentations bi-monthly to one of the work groups? What is the timing that is most helpful depending on the type of evaluation? So if it's process evaluation, maybe ongoing feedback on the processes and how those things are going. Thinking through what are the specific things that are being asked of the research partnership. So is the evaluation the end goal, or is there something else that you're looking for? So you might... Sorry, did you have a question? So thinking through what the types of the products or deliverables that would be helpful for the research partner to share, to be able to support the initiative and to have ongoing and clear communication. And then thinking about a process or a feedback loop for revising. So as you go along, you may have thought you needed one thing from the research partner, and then you realize they could help you with something else as well. So really being open to that communication as well. So research partners' knowledge and expertise. So I think I mentioned this already a little bit, but thinking about cultural responsiveness and knowledge of your community, or the ability to learn what's going on in your community if they're not a local partner. Thinking about how they are able to provide information in terms of research that will be helpful to the team that's actually doing the implementation work on the ground in the field. Thinking about how to support the implementation of the practices that are around lead. So like harm reduction, case management, how can they support that, for example? Thinking through how there are organizational pieces that a research partner could support. So really thinking through if there's additional capacity or analyses that you want around the organizational piece, or looking at how you're budgeting or things along those lines as well. So what do you need in a research partner? And I think this is a discussion for those sites who don't have one, really to think through and sit down. And we provided a 3-page document that kind of outlined some questions on this that was shared in the invite that will make sure that everyone has, that had some checklists that hopefully will be helpful to this. But really thinking about what you're looking for. Are you looking for someone to develop a data collection processes for you, or to analyze data for you? Or are you looking for, excuse me, a larger role for the research partner? Are they going to be a local partner, or do they not necessarily have to be a local partner? What is going to be most helpful to you? Is the goal a specific type of evaluation, like an impact evaluation? Or are you actually looking for them to develop a quality assurance or quality improvement process with you? Thinking about what is some of the key things, whether this is an ongoing thing or whether it's project-based. So you might have a specific funding source that's able to support the evaluation, and what does that actually look like? Thinking through whether it's an individual or a team. So some research teams might be multiple people, and sometimes it might be an individual research partner. What are some of the benefits or drawbacks to that, and how would it work best with your initiative in terms of communication and partnership? Then also thinking about what kind of expertise you'd like them to have. Do you want them to have a specific type of focus that might be helpful, such as they might have be through a school of social work, or might have done other pre-arrest diversion type work, or if they have expertise on housing and homelessness services, or if you want someone who's more of a generalist to really focus in on the data side for you. So just some questions for you to ask there. Okay, I'm now going to turn it over to Jessica, who's going to talk a bit more about developing a research partnership.
So even if you already have a researcher or data analyst on staff, a research partner can bring value added to your lead community. The research partner can assist the team in gathering data, synthesizing information, and evaluation strategies. And sometimes it's always good to have an extra set of eyes who can help you to analyze a problem, be it how to pull data in the most useful way, or thinking about research questions that you might want to consider. A research partner can also provide ongoing monitoring and feedback. I know that when I worked for a state agency, sometimes it's hard to always be looking at the data and seeing what's happening. So a research partner can provide you with an extra set of hands to analyze data and to think about what's happening with the data. So is it clean? Are things being entered correctly? Is there a weird uptick or downtick in certain things that you'd expect to be seeing? And it's also important to think that they're a neutral partner with unbiased perspectives. So sometimes they might see something in the data or something that's happening in the program, and because they know some of the context of what's happening, but not all of it, they may be able to provide some additional insight or some additional help. And they also offer expertise in areas that aren't necessarily available in-house, so they can conduct those evaluations that you might not be able to do. Next slide. So when you think about what you want out of a research partnership, there are a whole bunch of things that a research partner can do, and we'll definitely delve more into this in the handout that we have, but they can do data collection. So they can think about what new information you might want to capture, and also how to streamline data definitions across either organizations or even internally. So sometimes it's helpful to have an external perspective when it comes to thinking about what data means. They can also help to develop and administer surveys if that's something that you're interested in doing. Also, data cleaning. So data is always a little bit dirty, and sometimes that means that it's not particularly useful. A research partner can come and help to clean data and make it easier for y'all to analyze in-house or to begin to do some analysis on their own. So a research partner can analyze data, and they can either do things like routine performance measures, or they can do sophisticated statistical analysis that y'all might not be able to do. And finally, we get to reporting data use. So they can help with reporting. They can help to report those performance measures. They can help to think about ways to present data in a way that's meaningful and interesting. Additionally, data use. That research partner can come to the table with outside perspectives about how your data can be used, and they can also present another set of ears to help people think about what data they're inputting and what data can be useful in their day-to-day. And it's important when you think about all of this to think about the logistics. So how often do you want to meet with your research partner? And then what will those meetings look like? Next slide. So what does the relationship look like for the researcher? So first you have to come in and listen and then talk. So there's always a value to the practitioner. There's always a value of the practitioner's knowledge. Everyone who's there living the day-to-day knows what's happening or what the data means in a way that some research partners might not be able to capture without taking the time to listen. And then it's really important to start with where the practitioners are and not where the academics are. It's important that as a researcher, you're thinking about ways that the information you're providing is not only useful, but also actionable. So I know there are times that we'll read studies and get really excited about things, but it's so far from where practitioners are, and for better or worse, that it's really hard to make the leaps to doing these big, gigantic, lofty goals without taking intermediary steps. And the research partner can help to get you to where you want to be. Next slide. The researcher can also help practitioners to stop and think. So one of the values of a research partner is that they can serve as an extra set of eyes, ears, hands, thinking about what additional information would strengthen the data story for LEAD, or taking the time to anticipate the needs practitioners might not have time to address. And they can also bring in fresh ideas. Next slide. It is very important for the researcher to come in and learn about the LEAD's experience with data and with research. So data can be scary, we all know that, but it doesn't have to be. It's important to think about what formats data has been entered in the past and how it can be made more useful going forward. It is also important to make sure that you're briefing the audience from the bottom up. And what that means is that as much as leadership needs to know what's happening with your LEAD initiative, the people who are doing the frontline work are the people that can tell you if there's something a little bit off with the data, or they can help to contextualize and ground the data. Sorry, we have someone mowing the lawn. Next slide. The LEAD site also has some responsibilities when it comes to this research partnership. So they should be active participants, and that means to use the information provided by the research partner in a useful way. And they should make sure to work together towards a true collaboration. And that means also providing feedback to the research partner when the information that they're receiving isn't particularly useful or isn't particularly helpful, and also taking that feedback to heart. Next slide. So speaking of collaboration, the LEAD site has a unique opportunity to expand its ability to educate and advocate for the community. And it's important to include the research partner in meetings. And sometimes it feels like another person at the table or another invitation to send, but it's important to get that outside perspective. It's also important to share data in a timely manner. So make sure that you have those MOUs in place and make sure that the research partner is getting data when they need. And then always to listen, respond, and be flexible. Next slide. So I know, having been at an agency and then also working in this role at CSG as a researcher, that it can be difficult to overcome some data obstacles. So there are times when we will go into a site, or when I myself have realized that people who are doing research aren't necessarily using data accurately or aren't using in the right way, that's not exactly what it means. So it's important to recognize that and to find ways to move past that. It's also important to have conversations about how to measure outcomes in a way that are meaningful. So I know that a lot of times you can think about the data and there's no possible way to capture that, but a research partner could be really helpful in thinking about ways that different sites have done things or ways that different processes have done things. And then also, it's just really, really hard to make the time to pull data and to have those conversations and to continue those conversations. Next slide. Quality relationships can be developed and curated through delineating clear roles and a structure for working together. So a lot of times this really just comes down to people doing what they say they're going to do. So discussing how researchers can be the most helpful, determining how and when project managers and other stakeholders will weigh in, having those MOUs in place, and then sharing data in a timely fashion to make sure that everything gets done. Next slide. So it's good to set expectations. So how will you communicate with one another? Who is going to be that point person that's going to be reaching out and making sure that this relationship keeps evolving and that everyone has the information they need? What sort of information will you share with one another? So sometimes there can be an information overload and you get too much feedback from your research partner. You're not really quite sure what to do with the data. So it's good to think about how much information you're getting, but also how much information you're sharing. How much of a backstory you're sharing about your lead story, and is that going to not necessarily taint, but bias the opinion of the research partner. So it's important to think about how much background a research partner actually needs in order to do their job effectively. And then come sort of the trickier parts, how to engage in proposal development and the differing views that might come with that, and also how to deal with conflict and changes to the scope of work. We all know that most projects don't necessarily end up how they were initially dreamt of. So scope of work will change. So how do you deal with that, and how do you deal with the conflict moving forward? Next slide. And now I'm going to pass it to Emily, who will talk to us about how a research partner can support evaluation.
Thank you. So last learning community, we gave an overview of some of the different types of evaluation, but we just wanted to return to those for a minute in the context of this discussion about research partnerships, because a key part of finding a research partnership and setting expectations with your research partners is determining what the evaluation needs in your site are. Some initiatives will have some degree of internal capacity to work on some of the evaluation pieces themselves. But I would highly encourage all of you to reflect on what that actual capacity is, and what you need from a research partner to support both your effort as it's taking off and also evaluate it once it's been established. Of course, having a very sort of robust long-term relationship with an evaluation partner is not cheap. So budget is always a consideration when you're thinking realistically about the level of involvement you want from a research partner. But I encourage you to sort of reflect and think about what your actual needs are and where you're getting those needs met when you think about evaluation. So some of the types of evaluation. Developmental evaluation is a type of evaluation that focuses on the initial development of an innovative initiative and adaptation of models, different models in dynamic environments across different contexts. This is a type of evaluation that's been kind of gaining momentum a little bit over recent years as people realize the complexities of the social world and how sort of difficult it is when you're, especially when you're working across systems. This, like I said, tends to be a pretty involved type of evaluation, where a researcher is basically embedded within a project team, helping develop strategies for collecting information about issues as they emerge and providing really frequent ongoing feedback to a team. So with LEAD in the early years of a LEAD initiative, this type of evaluation, if there's budget and capacity to take it on, would really help lead partners understand the context, the initiative's context, learn more about how it's developing, particularly with regard to things like alignment of all of the partners in the LEAD initiative, alignment between their different strategies of tackling different pieces of what's going on with LEAD. Also tracking progress towards establishing the key elements of LEAD's infrastructure in a site, and also things like identifying whether the agency that's providing project management is serving as an effective backbone agency that's able to balance the needs of all of the different stakeholders that are in a LEAD initiative. Process and implementation, tongue twisters. Process evaluation and implementation evaluation are also commonly referred to as formative evaluation. These terms are also sometimes used simultaneously. There's a lot of different definitions flying around about different types of evaluation, but generally process evaluation, implementation evaluation, formative evaluation, focus on whether there are changes taking place with regard to professional practices or individual behaviors among different system actors. Also, whether there are changes in cultural norms, in funding flows, public policies, things like that. And these are the types of changes that are the gateway to kind of the ultimate system level outcomes that LEAD is aiming to achieve. So process evaluation can focus both on whether the LEAD model is being implemented as intended, what pieces seem to be working and what pieces don't seem to be working within your particular context. And this is really focused on these formative pieces are focused on helping LEAD partners refine their initiative, improve their initiative, and sort of fine tune the work that they're doing. You can go to the next slide. Outcomes, impact, and effectiveness evaluation are also sometimes referred to as summative evaluation. And also these terms are sometimes used synonymously as well, particularly outcome and impact evaluation. So summative evaluation as a whole focuses on the extent to which an initiative is achieving its intended outcomes. So usually the term outcome evaluation is referring to looking at the short-term or medium-term outcomes, and impact is a lot of times used to refer to the longer-term or systems level impacts of an initiative. And a lot of times when people use the term evaluation generically, they're talking about this summative type of evaluation, outcomes evaluation. Formative evaluation is probably like ultimately more important for your own internal processes and for stakeholders within the LEAD initiative, but summative or outcomes evaluations are typically what like funders want to see, what they're looking at, and also the kinds of things that are going to tend to be published and contribute to sort of larger bodies of research knowledge about particular approaches. You can skip to the next slide. So we're hoping that by putting this logic model up every month that we talk to you, it will get really ingrained into your minds. And we'll keep referring to it in the coming months as we talk about specific metrics that you should be paying attention to that will support evaluation, both evaluation to improve and refine your initiative and also assess whether it's achieving its intended outcomes. So for now, I am referring to the logic model here to illustrate how you might frame a discussion with your evaluator, either one that you're looking for or one that you already have, about what kind of evaluation you're looking for and you need in your site. And this, kind of looking at the logic model together can also help them think about what kinds of things they could focus on. So you can have a shared conversation and point of reference when thinking about what your needs, what your evaluation needs are, and what you should be looking at. So like I was saying, the process evaluation or formative evaluation will focus mostly on the lead initiative structure and implementation, what's going into the effort, who's involved, how are they involved, who is the initiative reaching, things like that. And then the outcomes evaluation or the summative evaluation will focus on what lead aims to achieve. What are the intended participant program system level impacts, and how is progress being made towards those impacts? So I think that's all for me. I think it's time for us to go to breakout rooms.
Excellent. Thanks so much, Emily.
Can I ask can I make one question? Just of
Yes.
all the information we've just given anybody, if there's a burning question before we go into breakout, I wonder, Sarah, can we take a minute, just see, pulse check and see if there's questions or thoughts on what's been presented so far for the group as a whole?
Absolutely. You all can feel free to unmute or use the chat. We are monitoring that too. If you have any questions, reactions, comments. Okay, we have a question in the chat from Kate. It says, is it generally good practice to do process evaluation before impact? Okay, interesting question there. I'll have maybe Emily answer this since you were just talking about the different evaluation pieces.
Yeah, sure. So a lot of times when I, as an evaluator, am planning my evaluation, I tend to think of them as sort of co-occurring. Formative evaluation is like, you know, that kind of linearly has to come before, because you're not really going to see any impacts until things are up and running, until they're going. But formative evaluation doesn't end sort of after a program is implemented and up and running. Ongoing formative evaluation is really important for noticing sort of when things stop working, or what things kind of need improvement along the way. So I wouldn't necessarily, yes, I do think that formative evaluation kind of chronologically starts first, but it shouldn't end when you start doing summative or impact evaluation, because there's always going to be room for improvement, and having a partner that can help you identify where those areas for improvement are is important, no matter whether your lead initiative has been going for 6 months or 10 years.
Okay.
From my perspective.
So really, in that sense, like, I guess what I heard was impact evaluation shouldn't ever go first before you're sure that the formative pieces are set, but that the formative evaluation is ongoing.
That's how I see it. Sarah or Jess, do you have other perspectives on that?
Thank you.
If I could offer one comment, coming out of the world where we reported a lot to grantors, to funders, I know it's really easy for organizations to focus on what the funder wants to understand, and that sometimes can become the primary focus for evaluation. But I think one of the things that's being offered here is to broaden the understanding of the way in which having an ongoing evaluative focus or sort of spirit can help the people who are actually doing the work do the work better, without necessarily thinking that this is something you're doing in order to report out.
Something else that I was just thinking about is that I've heard evaluators be referred to as a critical friend, and I really like kind of thinking about that way of sort of conceptualizing an evaluator, because I think that, you know, like, not only can they tell you like whether things have worked as you planned, but they also, you know, along the way can be honest and, you know, say like, you know, maybe our goals are in alignment. As an evaluator, I tend to not take on a project unless I am on board with what they're aiming to achieve. And I see it as my job to provide sort of critical feedback and let them know ways where I think that they can improve what they're doing to better achieve those goals. And, you know, I try to do that through establishing a trusting relationship where they know that I can tell them hard things, but it's with the goal of trying to achieve the goal that they're set out to achieve. And so I think that having that ongoing relationship with an evaluator and receiving formative feedback periodically, it can be hard on both ends, but ultimately it will help you kind of build a stronger initiative and get where you're planning on going.
And I think it's a really important point, and I know that we hit on this a little bit, but just them not being from an outside agency is just so important, because especially when you're talking about like a process evaluation, for example, then they can see things in a different way because they're further removed. So I think that piece, just hitting on that again, is super important. Does anyone else have questions or anything you want to discuss with the larger group before we move into the breakouts? Okay, I tried to give a long silence just in case. So what we'll do for the breakouts is we're going to have 3 different groups, and we're planning on about a 20-minute discussion. So we'll probably be back here then at 5 after the hour, and we'll break out into these 3 groups. So the research partners are going to be in a discussion with Emily. Jessica is going to lead a discussion for sites with research partners that you're working with currently. And then the 3rd group I'm going to facilitate is sites without a research partner. So we'll be having 3 different discussions, then we'll come back as a group and share some of the feedback from each of the different discussions. So for group 3, just note I may be a minute late or so, because I want to make sure everyone gets into the breakouts before I leave this piece. So I'm going to open the rooms, and you're gonna choose at the bottom of your screen which one you want to go to. So there should be something that pops up that says breakout rooms, and then you're able to select into one of them. So please let me know if you're having trouble getting into a breakout group. We want to make sure that everyone's in one before we leave the main room.
Baltimore.
Hi, Sarah.
Hi, everyone. Okay, so everyone successfully got into breakout rooms, so I'll consider that a success for the day. So good job to all of us for starting to understand Zoom a little bit, I would say. So it sounded like were people doing introductions?
Only just a little bit. I don't know Amethyst, so I was asking Amethyst, but we haven't done intros.
Okay, So some of you are, it looks like, would already know each other because you're from the same site. But if you just want to, if we can just go around, say your name, the program you're working with, and what your role is in the program, and then we can know each other before we start the broader discussion.
Hello, Bern Sherwood. I'm the manager for behavioral health programs at the New Orleans Health Department. We're the kind of primary operator of the lead program here, and I'm the interim project manager.
I'm Travers Kerr with the New Orleans Health Department as well, too, as the program coordinator for LEAD, and work with Bern on the LEAD program here in New Orleans.
I'm Travis Brooks, project manager for Ithaca LEAD.
I'm Amethyst Spivak. I'm the assistant state's attorney with LEAD in Baltimore.
I'm Tatiana Thomas. The organization that I work with is doing the case management for the Ethical LEAD project.
Hi, this is Arish Narayan. I am the project manager, interim project manager. Danielle couldn't be here today for Behavioral Health System Baltimore and the LEAD project.
Okay, great. And I think we met Rebecca at the beginning of the meeting, and then I'm Sarah Wurzberg from the Council of State Governments Justice Center, and I've been facilitating these discussions. So if you've been on before, then you may have heard from me already, or maybe even too much, as we're at session 4. So a lot of talking from me. So today, what we're really looking to talk about, and I actually know that some of you have had research partners in the past, is what have you had any past experience with research partners, I guess, as our first question. Then we can kind of discuss a bit about what you would think about trying to develop these relationships moving forward too. So I know in New Orleans you had past experience with research partners. Yeah, so might I turn to you first?
Sure. We've had a couple of research partners in the past. One was through the Vera Institute, which was kind of conducting a program outcomes evaluation for us. It is kind of still in the works. From some data that we had collected, I believe the last of it was in 2019, so it's a little old now. We also partnered with a research partner through one of our local medical schools to evaluate lead clients' sort of pre and post hospitalization usage in our local institute here. That one was kind of it was a cohort study, so it was supposed to last for a particularly long period of time, and we had put that one on hold too, as the coronavirus kind of changed a lot in terms of how people were using just basic services at that time. So those were sort of our two main research partners in the past. One we had agreed to partner with the Vera Institute was through a contract. The other one was just kind of an MOU that was done through the school. So it was free, essentially, free service for us for the time being. Brian, feel free to jump in.
Yeah, I guess I would just add that when it came, things, the pandemic just definitely put a hurt on the process in both of those, for both of those partners. The outcomes evaluation involved interviewing clients and police officers, and the access to do that was just not as it would be under normal circumstances. So it was not done as fully as originally planned. And then, as Travers mentioned, it really put a hurt on the analyzing emergency room use.
Yeah, so I think it's interesting because there's two very different approaches to those different partnerships that you were doing. And I think also you were able to get some potential free evaluation services, which I think is really desirable to a lot of sites of trying to develop that partnership with the local university. Can you tell us a little bit about how you were able to broker that relationship? Was it someone who knew about LEAD, or maybe one of you knew? Like, how did you actually develop that?
Yeah, it was kind of a bit of a one-off sort of scenario where somebody who was an employee of the health department went to med school and picked up this project as part of his studies at med school. So he was already aware of LEAD from that perspective, and from working at the health department, and was interested in really kind of supporting it, while also, I guess, meeting some of his coursework requirements. So it kind of happened by a bit of a fluke. That said, I think there's, it probably points to the fact that there are other students either studying public health or medicine or what have you that might want to do projects like this in other localities that can be tapped to do this sort of research. I think the challenge with it is that they had to go through an IRB process to get it off the ground, and that took a while. And the length of the study that was originally anticipated went beyond the scope of this person's med school tenure. So passing the baton on to others to keep that study afloat is a little bit of a tricky thing, but it could probably be fixed by working with a professor at the med school or whatever school becomes a partner.
Yeah, definitely something to think about. And sometimes getting one of the professors involved in addition to a student can be really helpful to make sure that there's continuity, at least in oversight of the project too. Did folks want to go next in Ithaca or Baltimore to share a bit about if you've had past experiences, or if not, what you might be looking for?
The Ithaca project is very new. We just started this year, and I think that we are building a relationship with a research partner. I'm not quite on that end of things as being part of the case management team, but in-house, I'm actually I work at the REACH project, who is the case manager for our Ithaca project. And I'm also our manager of research and clinical informatics. And so, looking for a research partner, I think I can speak to how we operate within our EHR, how we plan to operate within our case management system, and what outcomes we're wanting to look at and evaluate for this project specifically. And I think the key part about finding a research partner is just being able to find someone that we can foster a relationship with that is able to help support those goals of ours.
So I've been working with 3 of the schools at Cornell. We are trying to determine which school is going to take on the project and how they are going to utilize the students over the next few years to do the work. So we're in progress with Cornell.
That's great to hear, and nice to have such a large university right in your town there to be able to use. What types of, you mentioned you're talking to a couple of different schools. Just curious to hear, what types of disciplines are kind of interested in the project?
It's not necessarily the discipline. Right now, it is what school has the capacity with grad students to make this an ongoing project. There's groups, like there's a capstone project, for example. It may fall into that. So, some projects with the students at Cornell is a one-time thing. We're trying to have a group of students start us off with our entry point, like the starting data, and then students go by semester or by year. So depending on how long the project would be for that particular group, what school, for example, would have the capacity for the next group of students to pick up and take over from there without having to start over each year as a brand new project, if that makes sense. I know I probably didn't answer your question, but
No, it makes a lot of sense. Yeah, because you really want to make sure there's continuity in the program in the long term. So you're trying to build that in, I think, which is really smart. On a personal note, but my husband actually works at Weill Cornell Medical College as a researcher, so I have a bit of a Cornell connection as well.
Oh, nice.
Yeah.
Nice.
So small world. So I'm like, my ears perk up. I'm like, Cornell, yes, I know a lot of people who work there, actually.
Yeah,
maybe that's to offer perhaps a little bit of an in for Ithaca to get into Cornell.
Yeah, we've done a few projects like this in the past with them. They just haven't been ongoing year after year. They've been like one-time projects. So that's the difference. So we're just trying to find, which school would want to do that.
Yeah, makes a lot of sense and very strategic. What about from Baltimore? Have you all had any experience with the research partners at this point, or you have been looking into it at all?
Arish will know more about the history. I've only been with the group since October, and since I've started, we have not worked with research partners, and our best efforts have been to look into better platforms for holding our data and sharing data across sites, but in a way that protects, that PHI, but allows officers to see stuff, but allows me to do things. So we found some pretty good resources there. Just, do we have the funding and can we implement it? But I think we have University of Maryland and Johns Hopkins here, so we should be able to find good partners, and I don't know what's happened in the past though. So Arish, that's you.
Yeah, no, I'm gonna, along with your comments, I'm in the same vein. It's a funding issue. Obviously, Hopkins and other University of Maryland entities and other folks who are invested in this work are interested, but we simply just have not had the funding for like a third-party evaluation. Obviously we have the data that we collect for each lead referral, whether it's BCRI or the state's attorney's office, or the stuff that we share internally, but it's still in the infancy stages. That makes sense in terms of a research partner.
Amethyst, just to pick up on that note about trying to understand what platforms would be best suited to you, that's exactly why this tech acceleration project is being folded in. We would love to be able to help you think through that experience and possibly be able to provide some support in mapping out the set of needs and the set of systems that are in place that would help inform that decision. And I'm curious, so I'm not implementing a lead project. I have in the past. I'm with the Public Defender Association in this role. But when we were implementing ours, we had an evaluator. We had the Urban Institute doing an evaluation. But I never really thought about us in terms of having a research partnership. The evaluation was in order to help prove something in the end. And I think it's fairly uncommon for organizations in the nonprofit sector to think about what can we learn through research and to build that in. And I think even in the public sector, like our project manager was a public health agency, but they were really used to evaluating contracts and outcomes from their contracted organizations, but I don't think they even thought of themselves as research. And so I'm wondering whether sites are thinking about what are the kinds of questions we want to ask that a researcher / evaluator could help us answer. I remember, Travers, I think it was you, one of the earlier meetings, you were talking about the various ways in which the locale, sort of the geography of NOLA was affecting where people could go and the sort of the the gaps that you were seeing. And so, you know, the questions come out of that. Well, how does that inform the question you're trying to answer, the problem you're trying to solve? And so I'm wondering whether other sites have actually asked themselves, what question would we like to have answered if we had access to a researcher?
Well, that's one of the tasks that we have asked the CLT to look at, to develop some of those the questions that they would want, some of the data points. Yeah, so they are working on that.
I used to do research at Hopkins. That's how I met my husband and ended up in Baltimore. And so when I see the information we have, I'm like, let's write a report. And so I'm just really anxious and excited. There is one organization that I think would be interesting to get you all to look at and get your feedback on. Have you heard of Shared Village? So it's an attorney in Baltimore that used to be a project manager, and started this data management system. And so LEAD and I think our Washington County area, they're using it, but it's really kind of neat in that officer on the street can put in an app, you know, the information needed, it can trigger me to do an eval, and then case management can keep all of their stuff in there. So it's really kind of neat to see, but it's the only one we've seen like it. So there's nothing for us to compare to, but it'd be really interesting for you all with the research perspective to potentially meet with them too and understand the program and just get your insight. Like, is that the right program or not?
It's exactly the kind of question that everybody is dealing with, and that the tech acceleration idea is really designed to address. And the way at the beginning I said all LEAD sites have sort of a shared set of problems, which is that you have to have a lot of data and it's among various systems, and you also have to have operational data readily available. And so there's actually quite a few that are doing the kinds of things that Shared Village looks like it wants to do or offers. And of course, case management and interoperability, and then other things around data and tech inside an organization, organizational operations. Sometimes what happens is that you choose one solution without recognizing its implications for other elements of your work. And so, I've made myself a note that that's one of the things we would talk about with our tech accelerators, is to make sure we can offer kind of an overview of the kinds of functionality that services like that are trying to address, because it's the functionality that's at question. And then it's the question of how best would a system, whether it's off the shelf or relatively customized, meet the needs that we have locally. But your comment about let's write a report, I think, and then I'll stop talking, but I think that's a kind of impulse that many times in the nonprofit world, we're not really encouraged to consider. We're encouraged to write reports to funders, but not necessarily to advance the field. And so that's why I'm thinking about how researchers, if you thought to yourselves, what kinds of questions do we want to ask would help us understand the landscape better, the field better, I think a researcher could be interesting there.
I mean, I talk about it in other meetings I had. It's either Santa Fe or San Francisco's report, LEAD report. They had good questions and good, like, I feel like they asked good questions. There were some, follow-up questions that I have, just why after 6 months did we see not as great of effect in terms of recidivism? But I think they asked great questions. And if we could kind of start seeing that across the nation, that would be amazing.
Yeah, I think that's part of the goal of this effort, is to help sites build the capacity to be able to evaluate and think through, if there are commonalities that people are interested in looking at. So like the next couple of sessions, we're going to break down and discuss systematic, system-wide kind of metrics. We'll discuss programmatic and individual metrics. So kind of discussing the different pieces and different levels that might be available for folks. So hopefully just hearing from other sites on what they're collecting and seeing the commonalities, I think we're hoping will be helpful to everyone as well. which is why we keep coming back to that logic model, which we're gonna, hopefully get some mileage out of as you all work through this. Okay, so I need to close the breakout room. So want to thank you all for your participation. We'll go back to the larger group for a little bit, and hopefully you'll all participate in that side of things.
Nice to talk to all y'all.
Thank you.
Good to see you.
Members is just amazing. It's been wonderful for us.
Okay, so I don't think everyone's back from the breakouts yet, so we'll give everyone about a minute. I think people are going, hopefully that means the conversations are good if folks are still in the breakout groups. So I think we're missing one group, so we'll wait until Emily's group is back.
Hi.
Hello. Okay, so we did add some more time to this session, and I know we had communicated with this via email, but in the last couple of sessions, we had the breakouts, and then we never really had the opportunity to debrief with the larger group. So we wanted to make sure that we tried to create additional space for the group to have larger group discussions in addition to the smaller breakouts. So that is our goal. So we're hoping that, the majority of these remain really discussion oriented. But just to begin with, what are some of the key takeaways from some of the breakout groups? What did you discuss that you found interesting or helpful?
I think we definitely in the research group talked about some things that could be helpful for sites to hear, especially those sites who are just working on establishing research partnerships. Does someone else from the group want to share out?
I suppose I can, Emily. So we kind of talked about, so Michigan State University, where I'm currently working and are the research partner for Detroit Lead. We have this kind of longstanding relationship with the police department, which has been great. And what we usually try to do is, we provide quarterly reports and all these things you kind of talked about in the beginning. But in addition, we have tried to embed kind of student analysts to help assist with projects, collecting data, consolidating it from different sources. And they can also act as kind of a support to the project manager, whoever it is. So we actually physically embed them pre-pandemic within the agency to kind of help build and foster that relationship.
And I think we also talked about students as an untapped resource, particularly PhD students who are looking for a dissertation topic. We had one person in our group who is who's doing an evaluation as their dissertation project. And I think that for those of you who are looking for evaluators, that I think that's some great free labor or not free if you want to pay them.
So Emily, I will jump in to jump off of that just because I'll throw on my Albany hat instead of my national support hat for a second. So we actually had a conversation around when the sites are ultimately choosing folks, and especially if they have that great opportunity, just that they shouldn't just jump on that because it's free, that they should still do their thorough homework and vet people out. And we were lucky enough with Adam for Albany to vet that out, and also have Dr. Udo as well to be able to vet somebody out who was a good fit. And the policy group, when that presentation was done, the policy group agreed and said, yes, this is good. There actually has been past opportunities that the policy group and people on the policy group have vetted out and said no to, based on those not being appropriate fits, based on the fact that there was not confidence in the folks that came forward and wanted to do that work, and have actually said no to before in Albany. So I think for the other sites, it's really important to keep that in mind, that just because it's free, just because somebody's coming and calling and saying, hey, I want to do this, does not mean that folks should jump on it. They should actually vet that out and make sure that it's the right fit. Make sure the person who wants to do it is actually going to come in and do it and take care of the things that the site needs to have happen, that it's going to be neutral, that it's going to actually have integrity to it, and not just be something that's going to be a product that nobody's going to be able to use. That product needs to be something that the site can build off of and make whatever changes they need to make, and actually be legitimate to the policy group and legitimate to the community, because otherwise it's just going to hurt the site. It's not going to help.
That is 100% correct. Sorry if that was too flippant the way that I presented that.
No, it wasn't flippant at all. I was glad you said it the way you did, because it was part of the conversation we just had in the breakout room. So I was glad you kind of set it up perfectly. So thank you.
It actually came out in our breakout room as well, because one of the sites had experience both with a paid evaluator and an evaluator who had approached them from a local university too. So I think it is a common theme in terms of something to think through. And I think another topic that came up was trying to develop it so it is more long-term, even if you're partnering with students. So it's ongoing rather than, it switching every semester, every year too. Are there other takeaways or thoughts that folks wanted to share from the breakout groups?
I'm curious, if I could ask a question, I'm curious whether sites are, like, to what degree are you feeling ready to consider research or evaluation, or is that even on your radar? Does it feel sort of like theoretical and down the road and nice to have, but not a high priority, or does it feel like it's something that's really essential to your work? I'm just sort of curious about that, because when we were doing ours, as I said in our breakout, we had an evaluator who was tasked with doing an outcome and formative evaluation, but I really didn't think of it as an internal research learning opportunity. So I'm just curious about whether sites are on that.
So you can definitely feel free to take yourself off mute if you have thoughts to share, or you can put it in the chat, and I will let you know that we're hoping for a discussion, but I'm also not above calling on people too.
I'll go. So I had just, for clarification purposes, are majority of the people on here barely starting the project?
There's a mix.
A mix. Okay. So for our site, I believe we're going to be starting our third year. So we have our evaluator who is doing qualitative, and of course we capture the quantitative data, but as far as qualitative, she is actually I believe on the maybe the second or third session with clients, and basically just asking how it's going, as talking to family members, community members. So for us, I think it's a little bit different. We're quite established already.
I think that sort of jumping off that, one thing that came up in our discussion as well is that, so Rebecca, as you were saying, sometimes there's this tendency to not really think about evaluation until like you have a report to give to somebody. And that sometimes from an evaluation perspective, being involved earlier on in the process is really helpful, both for developing knowledge about the context and thinking about the kinds of questions that you need to be asking to collect the right kind of data to answer those questions as you go along, and being able to provide formative feedback as well. And sometimes it's hard, like when you're in those early stages, to carve out like the budget to pay somebody to do that formative work. But that sort of work early on is really important. And then something else interesting that came out of that, as you were talking, Rebecca, about like building sort of internal capacity and like seeing sort of the value of research, and also knowing how to kind of do some of that work yourself. It sounds like in Albany, the team had approached the researchers and said, like, how can you, in addition to doing an evaluation for us, like, how can you help us learn how to sort of do some of it ourselves? And some people might, like some sites might have more capacity to take that on than others. Like there's not sort of an expectation that that is how it should be. But having some level of internal capacity, having an analyst on the team can also be helpful in some circumstances.
We're curious to hear just some of the lessons learned. What have you learned from development of research partnerships? This could be from the researcher or for any of the project staff, because we know a lot of you have had past experiences with research partnerships, even if you don't have them now.
Hey, this is Bern in New Orleans. I would say with regard to working with some researchers that may not, we were talking a little bit about working with a med student. Med students are not in their place of study for a lengthy period of time. So working with a professor or somebody who can bridge between other students doing research, if you're working with a med school or school of public health, that sort of thing.
Yeah, I think a really important tip in thinking about how to do the continuity for longer term work as well. Other lessons learned?
You there, Sarah?
Yes, I am here. Okay. So I know that we had at least a group from Ithaca talking about how they were trying to broker a new research partnership. So I'm wondering if you could share, because I thought the way you were approaching it was really interesting. Travis, are you able to share?
I didn't hear what you said. It went mute. I'm sorry.
Oh, that's okay. We all are having tech issues on and off these days. I think your discussion about your potential partnership with Cornell and how you were approaching it, I thought was really interesting. Are you able to share that with the group?
I guess we've been in communications with someone that we have done work with in the past who kind of connects community with Cornell, different schools, different programs that do research projects. And our goal is to, establish a baseline, but then find a class or a program that will continue to do the work so that there's some continuity in the research. So it might be this year's MBA student, PhD student, whatever it is, who gets our baseline established, and then somebody would pick it up, and then somebody would pick it up, and somebody would pick it up, so that over the next 3 or 4 years, we would have just some continuity in who was doing the research, knowing that it wasn't going to be the same student. So each year we're not looking for a new program or a new class to do it, that it would just kind of become standard in this particular class or program. So that's where we're working with Cornell on.
Great, thank you for sharing. And I think just the fact that you're thinking in the long term already about it is like a really good sign when you're in the developmental phases with some of these as well. I'm curious if any of the research partners want to share any lessons they've learned from working with the LEAD initiative sites or another site.
I guess I can go. So I've worked with multiple different programs to do the evaluation, and always, like you said, during the kind of going over some of the good practices. I think having set expectation, that agreed upon expectation, when we both have that, always is good. It usually goes very smoothly, the evaluation activity. I know what the partner wants, and I know what I can do, and kind of give a feedback and get feedback. I'm not driving the whole everything, it's the collaborative effort. When we can establish that relationship, it's always good and smooth and enjoyable to work for everyone.
Yes, thank you. Definitely the clear expectations. And so you know what you're supposed to be doing too as part of your role as well. So just looking at the time, I definitely want to get to this last question on what are things sites should consider in searching for a research partner. And I'm wondering if everyone can chat something in about what you think sites should consider when searching for a research partner for LEAD. And no problem if you have to jump off. But just curious, we have so much expertise on developing these partnerships. What advice would you give each other? What are some things you would say in searching for a research partner? Shared vision and goals. Setting clear expectations. Feel free to either come off mute or just chat things in and I will read it off. Thinking in the long term. Understanding the core principles of LEAD, harm reduction, non-punitive, not court supervised, field-based, collective impact, and that it's intended to shift the system as well as provide direct services. Somebody who is going to be invested and actually support the initiative, not just a paycheck. So very important, making sure they're aligning with the LEAD principles and that they're really invested in the success of the program and the participants is what it all comes down to. making sure to build in a budget for evaluation if you can, just acknowledging that that is, you know, a role that people have, and making sure that if applicable, you can potentially have some funding for the research partner. Making sure the research and evaluator has a clear line of involvement with the larger stakeholder group. We have one person that says, sounds great. Liking all the feedback here. And making sure there's a group of people to do something that was developed as well. So feel free to continue to chat in other comments or ideas you might have for each other. I just looking at the time, I want to make sure that I go over what we're going to do for next session. So next session, we're going to talk about the resources and systems change, and how to thinking about metrics for measuring systems change. So for you to think about for the next session, what resources are needed for your lead initiative? Are there resources that changed as you implemented your initiative, which there always are? How do you measure systems change? And then in your community, what are the systems change indicators? What are the things that are most valued in your community in terms of what your lead initiative will be focused on?
And Sarah, clarifying question on that first one, what resources are needed? Are you thinking about that resources related to evaluation data and research, or more broadly?
So it can be, but it's also in the logic model sense. So what are the inputs in terms of resources? So really thinking about, so it's a case management entity, project management, data collection and capacity. So a little bit broader than that. Thank you for asking. Then we had an additional chat on the last item, understanding that LEAS involves community and is driven by the collaborative process in terms of the research partnership piece. So our next learning community is going to be the 24th at 10 to 11:30 a.m. Pacific, 1 to 2:30 p.m. Eastern. If you have any questions, you can feel free to contact me. We really appreciate your participation in the session. If you have any feedback, thoughts, considerations, feel free to email me or talk to your contact at the Lead National Support Bureau. We hope everyone has a good rest of your week and hopefully enjoy a long weekend. Have a good one.
Thank you all very much.
Thank you,
Thanks,
Sarah.
everybody. Have a good one.
Thank you, Sarah. It's Lauren. Appreciate it.
You're welcome. Thank you for your participation. Be well.
Well, sorry I had to step out for a little bit.
It happens. We're all busy.
Bye-bye.
Bye.
Okay, so now we can go back to what we were